Okay, so welcome to today's webinar. Today I want to talk to you about one of the repertories which is very, very underrated, we can say unused, but remarkably useful. Unknowingly, we kind of use it, but maybe if we know it a little bit more, we can use it in a very, very artistic way. So we'll talk about Boericke Repertory today. So basically, it's a materia medica and repertory. So all the Boericks that you actually read have the materia medica section in the beginning and the repertory section behind. But it's important to know how he writes the materia medica. It's a pocket manual of homeopathic materia medica comprising of characteristic guiding symptoms. And then comes the most important thing that I want to tell you: clinical and pathogenetic form of repertory. So this is quite opposite to what normally we know about homeopathy, which is the individualistic form of technique of understanding the person. This is a totally a clinical repertory. This for a homeopath who knows a little bit of clinical medicine. Burnett writes a very interesting thing in the preface. He writes, "The fact is, we need any and every way of finding the right remedy. The simple simile, the simple symptomatic simile, and farthest reach of all, the pathological simile. And I maintain that we are still well within the lines of homeopathy that is expansive, progressive, science fostered, and science fostering." So now we know that especially we need to know all different types of repertories. And especially we need to know if we don't get a case in a given case, if we don't get a proper case history, we need to still prescribe pathologically. I learned this first time from my teacher in my college days, Dr. Vijay Vaishnav. I remember I was walking with him towards the college and he was a mentor. In fact, one of the reason I can make videos is because of him. He really inspired me to take up homeopathy. I was a problem child, but that's another story. So what happened was I was walking with him towards the college gate and I saw a watchman come by and he said that he has a bad swelling here. And he examined, Dr. Vijay Vaishnav examined him and he said this is like a growth that is happening around from here to here. And he called this as what is called as a pterygium. And then, interestingly, he told me there is the main remedy for pterygium, he says, is zincum metallicum. Because in this case, the pterygium has burning with it. Very interestingly, we can have a look. Let's see. Pterygium with burning and itching. Zincum. This was my first brush with Boericke Materia and Boericke Repertory. So we need to know that this is a clinical repertory, which is by Oscar Eugene Boericke. You have to know that the Materia Medica is by William Boericke. It can create confusion. And there are different editions that have come out. Majorly the third, fifth, sixth, eighth, and ninth. The ninth was in 1927 by B. Jain. The plan and construction of the repertory is as follows. There are many chapters in this repertory, almost up to 24 chapters, from mind to modalities. What is interesting is the way the rubrics are formed. It starts, all the rubrics in every chapter starts from causation, then the type of symptoms, the location, the character of the pain, the concomitant, the modality, the aggravation, and the amelioration. I want to talk to you, but mainly about practical clinical use. I know there are many students and interns and especially MD students who are watching this video, but I want to tell you how to practically use it. And that's where the entire fun is. I want to talk to you about the following topics about Boericke Repertory: clinical symptoms, particular symptoms, peculiar symptoms. What does the symptoms in capital mean? The mind symptoms, the comparative study of materia medica, rare remedies, relationship of remedies, and dose. I'll tell you two, three of very interesting case that I did recently. This was a case of a low motor neuron paralysis of a young child, totally emaciated, unable to walk, difficulty in walking. And I took the case, entire case. I spoke. This was a case, a child coming from a village to see me. Entire body degeneration and paralysis, not able to move. He couldn't tolerate fasting and hot. So I just put these important, just the clinical things into the repertory of Boericke. I put emaciated marasmus, ataxia, paresis, and paralysis. And I found an interesting remedy coming up. And the remedy is plumbum iode. Then I studied it from the Boericke Materia Medica. It's written, it has been used empirically in various forms of paralysis and especially sclerotic degeneration of spinal cord atrophies. This makes this remedy a top remedy for any kind of chronic paralysis. Remarkable that we normally think about plumbum but not plumbum iode. I want you to use it more often. So I gave it in a 30 potency BD. For the first 15 days, there was no change. Then I made it 3 times a day, and remarkably, the paralysis started reversing slowly and steadily. And now the child is able to move on his own with the help of crutches. Although he has not cured, but the remarkable change is very, very satisfying. And with help of Boric, when the symptoms are not there, you can give pathological prescriptions which have very, very interesting results. I want to share with you one more interesting case that I did about a year back. A 50-year-old man, stoic man, not able to talk at all. He just came and told me that I have extreme craving for alcohol. I want to leave it. You help me. I took his case. I asked him different questions. He was not talking. At this point, I decided that I needed a pathological remedy. So I put it in the rubrics, ailments from especially alcoholism and lot of desire and abuse of alcoholism. And I found an interesting remedy, Quercus, quite queer remedy. So I read it, Quercus glandulus spiritus. And I found an interesting indication there. Takes away craving for alcoholic, especially given in the following dose. Quercus I gave in mother tincture. Slowly, steadily, this is our follow up. After 6 months, his desire has reduced by almost 80%. Previously, the entire day he would be in a bar. He used to go to a desi bar and drink entire day. He started working on his own. So he now has querculus glandular spiritus, 4 drops in half a glass of water daily for past 6 months, and he's remarkably, these are the remedies which we need to learn as well. It's important to know the calcareas, the phosphorus, the lachesis, the constitutional remedy, the single dose magic. But this is the another form that I want to tell you. I want to teach you this. So there are many clinical symptoms in Boericke. For example, I remember interesting case with tuberculosis, which is just begin with lot of bleeding cough, and the remedy was Acalepha indica. It's written, it is indicated in bloody expectoration with incipient phthisis. Now, this is a clinical symptom. Undescended testes. I remember one case of undescended testes with no symptoms. Just in Boericke, it's written effective in undescended testes in boys, thyroid in him. Another case I remember, patient had come with a cardiac coronary block with a very high blood pressure. And the remedy, interestingly, I gave tabacum, should prove the most homeopathic drug for angina pectoris with high tension. Now we have to think other ways. Which remedy lowers the blood pressure? Telaarenia. This is the remedy where the BP remains low. Low hypotensives. Telaarenia is a remedy which is made up of from spider's web. Remember this remedy in low BP. There are many peculiar symptoms if you want to use Boericke Repertory. For example, Cough better by lying down. Emotionally better by lying down. You can see the remedy manganum aceticum. Better by eating. You can see Anacardium orientalis. This is a very simple thing, but I want to give you a basic idea. I will tell you one very interesting case. This was a case of cancer, a liver cancer, but because of that there was a lot of wounds in the leg, and there was metastasis to the bone happening. But what was happening was he got operated, but especially around the skin it had become very tight. So one homeopath was given calendula for a very long time. I understood the case and I gave a remedy, very interesting remedy after studying. The remedy is Califos. It's written in Califos. After removal of cancer, when healing process, the skin is drawn tight in the wound. So interesting. So interesting, I want to tell you. For example, there are many terms and conditions which are of last generation, like tea taster's cough, Kelly iode, which means especially very dusty cough, fungus, very allergic cough. I remember another case. A patient had come to see me, and he used to get a lot of sore throats. So I asked him, "What happened? How did you get it?" He said, "My relatives are admitted in hospital. I'm there for last 2 months. So they are saying it is hospital acquired infection." So I opened Boericke and I found a very interesting symptom: hospital sore throat. It's written Kalimur. So interesting. Also, many remedies are given in capitals. For example, you can see chininum sulf, acute articular rheumatism. This is given in capital. That means it's a clinical specific for it. One patient had come with no symptom, just you say all over body there is a aching pain. No other symptom. Vitamin D normal, B12 normal. Just I went over Boericke and I found radium bromide. Severe aching pain all over. One patient came, he said that I feel very nervous. I had flu few days back. After that, I feel nervous and weak. Very interestingly, I found a remedy, scutularia. There are many remedies that I'm telling you which are new, but if you have to use it in your practice, and they work fantastically. You have to learn all methods. I've learned everything. I use different repertories. I learned sensation method. I used Vijaykar's method, Segal's method, mind rubrics, dreams, Boericke specific Indian drugs. Everything we have to learn, and we have to master it. Scutularia, nervous weakness after influenza. Patients undeveloped memory glands. Very often patients will come. Subalcerulata. This I think you must be knowing. One patient came with his son. I would say that constantly he just points towards the navel with pain. Which is a remedy? Think. Spigelia. Child refers to the navel as the most painful part, and in bracket it's written granatum. Remember. Also, Boericke Repertory and Materia has physical particulars. Patient came to me with a huge swelling of the knee, like a effusion of the knee. It was a OA with effusion of the knee. Only one remedy, Kali iode. I use this remedy a lot. Fantastic remedy. Much better with Kali iode. I don't have to think twice. If I get an indication, it will work. I remember another interesting case. One patient with torticollis had come. Torticollis is like a wry neck. And his main symptom, he was constantly talking. So I opened repertory and started studying which remedy torticollis was given. So how did I do that? I'll show you. I opened Boericke. Let's see. I'll open Boericke for you. Let's open Boericke repertory. Hmm? Where are you, Boericke, my friend? And I open Boericke. This is a therapeutic index that I use very often. And I open torticollis. And I found an interesting remedy. This is not lachesis. This is lachnanthus. Then I started studying what is the lachnanthus. So I opened lachnanthus. And when I opened Lachananthus from Boericke, I found something interesting. First, it's written it's a remedy for torticollis and rheumatism of neck. And then it's written produces a desire to talk, flow of language, and courage to make a speech. Exact. So fantastic. Use this therapeutic index very often. It is given in end. I use it remarkably. I remember another case of uremia where the creat had gone high, and because of that, there was a convulsion, and I had given him cupramars in low potency. You have to learn this art, my friends. You have to learn. Fantastic. You know, between watching a movie and prescribing, practicing, and studying homeopathy, you can imagine what my choice will be sometimes. Comparative materia medica. Also, with Boericke Repertory and materia medica, you can compare between few things. Let me show you a little comparative materia medica of just sardi or colds. How to differentiate colds. Patient comes to you and say that I have acute cold and sore throat. Which would be a top remedy? Top remedy is Saponaria officinalis. It's written in Boericke of use in treatment of acute cold will often break up a cold. Patient comes to itching in the nostril along with coryza. Arundo, remember, arundo. Itching in the roof of the mouth, remember Vyathia. Postnasal discharge, remember Phytolacca. Lot of sneezing with nose block, remember Kali bitch. Coryza with sneezing, Hach! Justicia. The main indication of justicia is profuseness. Patient comes with sardi, coryza, and after coryza, sinus. Remember, hydrestis, sinusitis after coryza. Constant watery nose, eucalyptus. Give this in mother tincture, it works fantastically. I remember this was a case of Dr. Sarkar, my guru from Kolkata. I spent almost 7 months with him. I've written one book on him, and I will be writing a new book which will come out in January. And when it comes out, I'll invite all of you. So, I remember this case of hydrocephalus. A child from Bangladesh had come, and I had taken the case in Bengali, Kemano Hobe, everything I have taken. And constantly his nose was dripping. I remember Dr. Sarkar told me, Beta, de do. He gave the remedy, Hedera helix. Remember? Remember? You remember I told you about this. Chronic hydrocephalus with rhinorrhea. Hedera helix. Remember it. Also, there are many rare remedies in Borik. For example, let me ask you one thing. You have to tell me the answer for this without me repeating. Which is a remedy? Suppose a patient comes and the child has a lot of eczema, and the mother says that he's just very good in studies. If he just reads something, he will remember it for lifetime. Think. You ask your teacher about this, they will tell you, or they won't. Okay. The remedy is pediculus capitis. देखिए क्या लिखा है? Unusual aptitude for study. It is given in Sorinum relationship of Sorinum. Ingrowing toenails. Which remedy it is given in italics? देखिए Magnum polus australis. Suppose sometimes in case you see all symptoms, shyness of silica, dryness of alumina, fear of calcarea, like this. Remember the remedy? Slag, very important remedy. Sulfocalcite of alumina. So there are many compound remedies like that you have to study. I remember interesting case. Housemaid's knee. This is also slag and sticta. Remember, one patient had come with huge glands, cervical glands, and he was chilly also, like silica, and lot of symptoms of natrum more. The remedy was silica marina. Remember, inflamed glands, silica and natrum more symptoms. And there are many combination symptoms like sciatica with numbness. It's a nephilum. So when a symptom gets connected to the pathology, that is also a remedy in Boericke. Wounds refuse to heal. We think silica. We think hepar. Boericke gives gunpowder. Remember. Also relationship of remedies. Very, very important. For example, Feltauri and Lachnanthus. Both have neck pain. Feltauri more with gallstone. Lachnanthus, I told you, very talkative. With TB. Another remedy, lobelia. Lobelia erinus. This is a very important remedy for stomach and especially omentum cancer. Remember this remedy. Very often, the remedies which you give in organ remedies, you need to give in a little lower potency, maybe 30, maybe 6C, maybe mother tincture. What is the main advantage of Boericke? The main advantage is small symptoms, big value, which means the remedies are very small. So even one, two indications if you get, you can prescribe. Clinical indications are given. For example, see, patient comes and tells you sleep. I get cough after falling asleep. There are so many remedies, but Boericke, the main remedy is this. You can see here, Arelia racemosa, dry cough after first sleep. But now you can't see Arelia here. You will think of lacasse sulfur. So you have to. This is a small remedy, big symptom. The disadvantage is you tend to only prescribe specifics. Specifics need to be given when there is no indication for anything else. So, especially for one sided diseases, only where clinical diagnosis is there, where you get no case at all, where you want to prescribe like a prophylactic, or maybe in acute, or maybe based on suppressed or exciting factors, think about Boericke Repertory. But I want to tell you something interesting. I don't use like this. My technique of using Boericke is very different. I use Boericke as just a entry point, and then I study the entire case. So if it's a case of plumbum iode, I will study if the patient has symptoms of plumbum. Is he like the plumbum patient? Is he in the sixth row? Is leadership his state, etc. If it's iode, is there a state of iodine in it? Like that. So I use it as a pointer to prescribe, but I see if the remedy matches the patient. This is the secret of homeopathy. And there are many important features. For example, this remedy has 1409 remedies. Many clinical terms are given, like I told you, tea tasters, cough. Remedies are often given in alphabetical order. To typology, there's normal and italics. Prophylaxis is given, especially in generalities. Toxic effects are also given. Clinical rubrics like bubonic plague, Addison's disease is given. Also, a lot of pathological rubrics are given, which are not there anywhere else, like choroid inflammation. Now, this last part is especially for my friends there in college, in second year, in third year, in fourth year, in internship, students and friends who are doing MD, who are in the last year of MD, in second year of MD, who are depressed. We don't know what to do. Should we do a job? Should we get married? What should we do? Should we cry? Should we leave homeopathy? Whatever. So I want to tell you, basically, homeopathy is not for faint-hearted. You will require to really sacrifice a large part of your life if you want to do something really special. But if you want to do something special, I will tell you, you will be so successful. Your life will become so different, so phenomenal. You need to dream big. You need to start small. You have to start from scratch, slowly, and you have to dream big. And you have to constantly refine yourself so much, daily, till at a point it becomes huge. I was recently talking and I realized the difference between good and great is only one: sacrifice. Are you ready to sacrifice a large amount of your time towards understanding our science? Then you'll be a phenomenal homeopath. And then success will be at your feet. I want to tell you what is the greatest joy in the life. And in life, the greatest joy one can get, especially I read this to myself very often. Be so good at what you do that no one else in the world can do what you do. The feeling that you get when you try to do this is just unbelievable. You try thinking about it without boasting, without ego, without self esteem. Just try doing this and see the fun. So, a lot of philosophical talks today. You can contact me, you can write to me, my email ID, my channels. Don't stop. Dream big and do something.